All right, let's talk about something you've probably heard of, especially if you're a parent or a teacher: school sores. What is this super common, super contagious rash, really? Well, today, we're going to dig into the clinical guide on Impetigo. We'll figure out what it looks like, why it can actually be more serious than you might think, and most importantly, what to do about it. So, let's jump right in.
Yeah, school sores, it's a name that sticks, right? And for good reason. It can spread like wildfire in schools and daycares. But here's the thing, that nickname kind of hides a really important fact. This isn't just any old rash, it's a specific bacterial infection. And knowing that, that's the absolute first step to dealing with it the right way. Okay, so here's our game plan for today. First, we'll nail down what school sores actually are. Then, we'll look at the 3 different types you need to recognize. We'll also get into why this is more than just a simple rash. And then we get to the practical stuff, the management plan, and we'll wrap up with the big red flags when you absolutely need to see a doctor. All right, let's dive into section 1. First things first, what is this infection exactly? So, at its core, impetigo is a bacterial skin infection. And the 2 words you really got to remember here are common and contagious. Super common and super contagious. It basically happens when certain bacteria find a way into the top layers of the skin, maybe through a tiny cut, a scratch, or even an insect bite. And just like that nickname school sores implies, this really hits young kids the hardest. We're talking about the 2 to 5-year-old crowd typically. I mean, it makes sense, right? At that age, they're all in close contact all day long, and their immune systems are still, figuring things out. Now, this next point is absolutely crucial, and it might even surprise you. You might think, oh, it's a rash, maybe it'll just go away on its own. And sometimes it can, but the official clinical guidelines are crystal clear. Every single case of impetigo needs treatment. Why? Well, for one, to stop it from spreading to everyone else. But even more importantly, it's to prevent some really rare but very serious complications down the line. This is why you just can't take a wait-and-see approach. Okay, so what are we actually looking for? What does this stuff look like? Because impetigo isn't a one-size-fits-all kind of infection. It actually has a few different faces, and knowing how to spot the differences is pretty important. So let's break down these 3 main types. First up is non-bullous. This is probably the one you're picturing in your head. You get these little blisters that pop and then form those classic honey-colored crusts. Then there's bullous impetigo. Think bigger. These are larger, more defined blisters, and this type is more likely to bring a fever along with it. And finally, the most severe form is called ecthema. This one is no joke because it goes deeper into the skin, creating ulcers that can actually leave scars. All right, so now we know what to look for. But let's circle back to that big question. Why is treatment so important? Let's get into why this is about so much more than just what's on the surface of the skin. So why treat a rash that might go away by itself? Well, there are 2 massive reasons. The first one is pretty obvious. You gotta stop the spread. Treatment keeps it from jumping from one kid to another or to the rest of the family. But the second reason, this is the really critical one. It's all about preventing a dangerous chain reaction that can be triggered by one of the bacteria involved, which is called Group A strep. Okay, check out this risk pathway. It lays out exactly how a simple skin issue can become something much worse. So, step 1, it all starts with that untreated skin infection. Then, look at step 2. The body's own immune system can have a major overreaction to those bacteria. And that overreaction, sometimes weeks later, can lead to step 3, really serious conditions that affect organs that are nowhere near the original rash. And what are we talking about here? Well, things like acute rheumatic fever, or ARF, which can cause permanent damage to the heart. There's also APS-GN, which is a serious kidney disease. And then there's sepsis, which is a life-threatening whole-body response to an infection. Now look, these are rare, but this is the absolute worst-case scenario that we are trying to prevent. This is why we treat that skin infection so seriously. Okay, so we get the what, and we definitely get the why. So now let's talk about the how. What's the game plan? What's the recommended course of action when you're dealing with impetigo? The management plan is really a 2-pronged attack, and you need both parts. It's like a puzzle. One piece is all about hygiene, covering the sores, constant hand washing, not sharing towels, all the stuff you do to stop it from spreading. And the other piece of the puzzle? That's the medicine that actually goes in and kills the bacteria, causing the whole mess. So when we talk about medicine, there are basically 2 main options. For a really limited case, like maybe just 1 or 2 sores, a topical antibiotic, that's a cream or an ointment you put right on the skin, is usually all you need. But if the infection is more widespread, if you've got a bunch of sores, or if they're in tricky spots like near the mouth, then oral antibiotics, pills you take by mouth, are going to be the way to go. And that brings us to our final and I'd say most critical section. How do you know when it's time to stop trying to handle it at home and actually go see a professional? Let's run through the red flags. Okay, think of this as your safety checklist. You need to see a doctor if the rash itself is getting severe. I mean, it's spreading all over or it's actually painful. Definitely go if blisters show up near the mouth or eyes. Also pay attention to signs that the infection is going systemic, like a fever, or if the person just seems really tired and out of it. And finally, if you suspect it's that deeper eczema type, if it's not getting any better after about a week of treatment or if it just keeps returning, yeah, it is absolutely time to get a professional involved. So, here's the bottom line. School sores might be common, but they should never be dismissed as something simple. A common sore really can be a sign of something more serious. And knowing what to look for, and more importantly, knowing when to act, is how you make sure it stays just a common sore and nothing more. Thanks for joining me.